It's good to see you all. My name's Aubrey, and I will be teaching the class tonight. This is the early home care class. This class is all about prepping you to bring your baby home 4 to 6 hours after birth. So for those of you who are new parents, this will be very helpful. For those of you who have not had birth before, also super helpful, because most of us, if we haven't had an out of hospital birth, we've never even taken care of a baby that is only 4 to 6 hours old. So we're going to teach you a few things on this class, a few things to watch for, and just general expectations too of that first 48 hours. And then we'll talk a little bit about the first 2 weeks as well. But for those of you who have had a baby with us before, welcome back. It's good to see you. And this will just be a review. If you did print out your materials, I would encourage you to just have them nearby, just in a safe space once you bring baby home, so that you can refer back to your notes, so that you can refer back to the information on there. You probably will refer back to at least something. If you are a note taker, I definitely encourage you to take notes. If there's something that sticks out to you that you feel like it would be helpful, or underlining anything or highlighting anything that really sticks out and that you want to remember, I think that it's great if you take some notes for this class. Most of the things that I'm going to talk about are in the class materials. There are a couple things that aren't, and I will tell you what those are when we get to them, so you can write them down if you'd like to. We do have a chat feature, and I will just say hello in there so you can see that. And then if you have a question, you can type it in there, or you can definitely unmute your microphone and just ask away. Don't hesitate to ask questions. It's actually super helpful, not only for you, but for others too, who might not be thinking of that exact thing. If any of you have wisdom that you would like to share, that you feel like it would be helpful about something I'm talking about, or if someone has a question and you have something to add, feel free. I absolutely love other parenting wisdom to be shared, so definitely do that. We will go ahead and get started. So the first thing that I'm going to talk about is just a few things that you can do to prep your space to get ready to bring your baby home. The goal is for you to come home and have this be a really smooth transition into rest and just caring for your baby and someone caring for you as well. So one of the things we recommend is doing some meals, just cooking some meals, putting them in the freezer, maybe take a weekend, look up some freezer meal recipes and just stock your freezer full of those meals. That is going to be super helpful in those first few weeks. If there's something that you're making where you can double the recipe, great, double it and then freeze half of it. Even if you're making treats or something like that, that's another great opportunity to just double up and put some in the freezer for later. So like cookies, banana bread, whatever it is that you like to make. A lot of times we kind of, like when we're doing freezer meals, we think of things like pastas or soups or, things like that. But I want you to think about breakfast items as well. So there's lots of I know there's some really good freezer meal breakfast burritos that are popular option. So kind of try to think outside of the box so that you can have lots of different meals ready to go during those weeks in your postpartum time. It's also great if you want to set up a meal train. Meal trains are fantastic. That's something that you can kind of just put someone in charge of. I know sometimes people are a little hesitant to do a meal train because it means possibly visitors coming in and out of your home, which is not super ideal in those especially in the first week or so, unless they're visitors that you know well. So if that is a concern for you, then what I would recommend is getting a big cooler and just sitting it at your front door so that people can just put the meal in there, and that can be part of the instructions on the meal train. And then when they bring it and drop it off, they can text you or call or leave a message in some way, and then you can go out and get that meal. If you do a meal train, just a couple of tips on that is kind of staggering it every couple of days, every few days, so you don't get inundated by tons and tons of meals. And then I also recommend extending it to at least 6 weeks. So 6 weeks may seem like a long time right now, but in the big picture, it is not. And there's a lot happening in that first 6 weeks with your baby. And it will feel so, so good to have that support during that first 6 weeks home with your baby. Now, on the visitor side of things, I think this is a good time to just kind of chat about what you want that to look like, right? So when do you want visitors to come into your home? When are you ready for that? My suggestion is to kind of like limit visitors that first, I don't know, maybe 10 to 14 days. Have visitors still come in if you're open to visitors during that time, but those visitors that are coming in should be visitors that are helpful to you in supporting you in your rest and in your time with your baby. It really shouldn't be visitors coming in to take baby and, think you should be close to your baby as much as possible, but maybe visitors that can cook meals for you or clean the house, or if you have other children, help out with them so that you're able to actually rest. We're going to talk about a 2-week rest period, and you want people to be supporting you in that. In order to rest for 15 days, a support system is vital. Like, you really can't do it without support. So just think about people in your life that would be helpful in that way. And just the biggest thing is to be on the same page as a couple on what you want that to look like, what you want who you want RK coming. Maybe sometimes, I hear people are like, we don't really want any visitors for the first week. Make sure that those expectations are set for those in your life who are wanting to come see. So, and don't feel bad. So just set the boundaries and create this time of just family bonding and being together and paint that picture how you want it to be painted. The other thing that I recommend doing is creating something that I call a nursing station or a breastfeeding basket. So this can be just next to your bed or wherever you're going to be doing the bulk of your resting. Oftentimes we maybe create a baby nursery or, a space like that, which is great and fun. But reality is the baby's going to be with you most of the time, pretty much all of the time. So, and they're going to be in your space, in your bedroom, in your bed with you, because they're doing tons and tons of frequent nursing, and they're wanting to be held a lot and they want to be close to you. So to help in this time of rest, especially that first 2 weeks, you want to have everything nearby, just right next to you, next to your bed. So you can get a basket or a cart or whatever you want it to be to just fill it with those items that you're going to need those first couple of weeks. So things to think about would be like extra diapers, extra wipes, extra outfits for baby, extra blankets for baby, breast pads, nipple cream, diaper cream, the notes to this class, snacks for yourself even would be super helpful. I recently did I'm a doula, and I supported a family and they were showing me the bedroom, for when they were coming home. And the dad had gone to like Costco or Sam's Club or something like that and created this massive spread of snacks. And it was amazing. And I was like, wow, I have never seen that before. That is fantastic. It was like a small little pantry in their bedroom so she wouldn't have to go anywhere while she was doing this rest. And I just thought that was really, really cool. So if you want to get creative and really go for it, that can be a fun surprise to do for your partner or for yourself. Just so you have everything kind of at your fingertips. Now, we're going to talk about rest and a plan for rest, but what's going to be talked about is allowing your partner or your main support person to get some rest at night, right? But you aren't going to be getting a ton of rest at night because that is when baby is most wakeful. So that is why you want all of these things at your fingertips. Most of you, if not all of you, probably have at least some support that first week or 2 weeks, which is great, but your support person also will need some rest. So while they're resting, that is why it's good to have everything just right there, ready to go. You're gonna be glad that you did it. And also it's just a super fun thing to get together in preparation for your baby. It's exciting, and you can just have it there waiting for that day when you come home. Any questions about any of that before we move on to postpartum instructions? All right. So we're gonna just go ahead and start talking about postpartum instructions there. While you are at the birth center, after your baby's born, we're still gonna be monitoring you, but the things that we're gonna be monitoring shift just a little bit, right? So we're still going to check your blood pressure and your temperature every once in a while, but the main thing that we're going to be focused on is first the delivery of the placenta and then monitoring your bleeding and making sure that your uterus is keeping that bleeding under control. But once you're home, you're going to keep an eye on your bleeding. Now, while you're at the birth center, that is the heaviest part of your bleeding that's going to happen. Okay, so right away when that placenta comes off of your uterus, that is when your bleeding begins. And that's where your bleeding is coming from, is from that placenta detaching. Now, just to kind of give you a little bit of a visual, if this is your first baby, is placentas are about this big. I hear dinner plate sometimes. Placentas aren't as big as my dinner plates, that's for sure. But you know, I would say about this big, give or take. You know, bigger babies have bigger ones, smaller babies might have smaller ones. They're all very, very different. But regardless, that's a pretty big area, and that when that comes off, you're left with a wound that size, right? So if you had a wound that size on the outside of your body, you would be taking care of it. You would be making sure that it's healing. You would be resting your body. It probably would hurt. The thing is this is on the inside of your body and it's not going to hurt. And so we can kind of forget that it's there, but it is there. And our reminder is our bleeding. And so this time of resting and recovering is to heal that. It's to heal that wound. Okay. So I want you to remember that when you get antsy and you want to get up and do things, just remember I'm healing this wound. And the more you rest, the quicker it heals. So once you leave the birth center, your bleeding is going to be pretty much like a heavy period. It starts to really go down pretty quickly in those first few hours. When you get home, you still can, of course, wear like the Depends or the large pads with mesh underwear. Those are fine options. You really could get away with just large pads in your regular underwear at this point. You really could. The only reason people continue with the Depends or the larger pads is for ease and for comfort. You know, it's easy. So if you want to keep doing that for a couple days, great. Just be sure to have those larger pads on hand for when you know are done with the Depends or the larger pads and mesh underwear. What you're going to be keeping an eye on is you want to make sure that that bleeding is not too much. Now, the signs are, one, you don't want to go through more than one pad per hour. So if you're completely soaking through one pad an hour, that's too much. And you want to reach out to the midwife, just give her a call and she'll kind of walk you through what to do and kind of assess over the phone, you know, what's going on. Sometimes you just have to give your uterus a little bit of a massage to kind of activate it and get it to firm up again, but they'll walk you through that. Doing lots of frequent nursing is going to be helpful too, which you will probably be doing. The other thing you want to look for is large clots or lots of clots. At the birth center, you're going to pass lots of clots. Some of them are going to be large, and that's fine. But by the time you go home, that should kind of, ease off and change, and you shouldn't be doing that anymore. What we're looking for when I say large clots is the size of your fist or the size of your palm. That's too big, okay? So if that happens, you'd want to give the midwife a call. The other thing to look for with clots is you can pass some clots and that's fine. But if you're passing lots and lots of small or medium-sized clots, that's another reason to reach out. A few here and there is fine, but you don't want lots and lots because it kind of then just equals a bigger one, right? So keep an eye on that. There is an exception to this, and that exception is if you get home and you are able to take a big long nap, which is our hope for you, you might experience a larger clot and then a bigger gush of blood. So the nap that I'm talking about is the one that we talk about. One of the biggest reasons why you're going home at 4 to 6 hours after birth. It's to get into your own space so that you can sleep. So the hope is that your baby's going to give you a nice big nap. That nap can be 3 to 5 hours long. Okay, it's at this time that everybody's hormones are kind of dying down and everybody, including your baby, is ready for some good restorative sleep. Now, if your baby sleeps for 3 to 5 hours, we want you to sleep for 3 to 5 hours if you can. So, so definitely try to do that. It is not promised. Not every baby will do that. And not every person can do it. I hear quite often when I teach this class that people are like, how do you do that? I get home with my baby and I know I'm supposed to take this big nap and I've tried before, but I can't. I'm too excited. I just can't do it. That happens. Do the best that you can, shut the shades if it's during the day, get your space dark, maybe turn on a sound machine or something like that, and really just try to sleep as much as you can. Now, like I said, if you have a nap, if you're actually laying down for 3 to 5 hours that soon after your baby's been born, naturally when you get up, that blood's kind of been collecting in your uterus. And then when you get up out of bed to go to the bathroom or you sit up, you're going to have a larger gush, like I said, or a large clot. And it's okay for that to happen that one time if you get the nap. Okay, so hopefully that makes sense. A lot of questions that I get to around that 3 to 5 hour nap is, what about feeding my baby? Aren't I supposed to feed my baby more than that? Yes, you are. This is your one time that it's okay. Okay, so this is the one time in the first 2 weeks, if your baby sleeps up to 5 hours, you can say, okay, go for it. But outside of that, yes, you're going to be feeding much more frequently than that. Okay. Now, as far as your bleeding goes, like I said, the more rest that you do, you're going to notice that your bleeding just gets less and less every single day. We notice that people that really stick to the 15 days of rest, their bleeding's done maybe 3-4 weeks after baby's born. Now, for people that have had a baby before, or maybe you've talked to friends and family members and they're like, I bled for 6 weeks or 7 weeks or 8 weeks. Yes, that can happen. And that is kind of more of the societal norm because most people don't rest for 15 days after they've had a baby. So you will find that the more activity you do, the more that bleeding will continue. Our goal is for you to be feeling really awesome by 6 weeks and that bleeding to be completely done. You're starting to get back to normal life, but the more you bleed and continue that process, the longer that takes. Listen to your body. So after your 15 days of rest, which I am going to break down for you here in a few minutes, you'll start to ease back into activity. And if you start to ease back in and that bleeding starts back up again, or it gets heavy again, that's your cue to reel it back in and rest another day, and then go back at it the next. So you really want to pay attention to what your body's doing. Your bleeding might stop completely by 4 weeks, whatever it is. And then you're like, oh, I'm not bleeding anymore. I'm going to start doing more things. Your bleeding can actually come back. And that's not bad. It's, again, just your body communicating to you saying, hey, that's too much activity. That's too much. And so you'll kind of reel it back in again and start resting again. So it's a great indicator of healing and recovery. The second thing that you're going to pay attention to, now, I didn't mention this, you're going to pay attention to your bleeding the first 48 hours specifically. Okay, so I should have mentioned that. The next thing that you're going to keep an eye on is your temperature, and you're going to do that for the first 24 hours. You want to take your temperature every 4 to 6 hours. You can do that however you want, orally, forehead thermometer, ear thermometer. For yourself as an adult, any of those methods are fine. Okay, what we want you to kind of be monitoring is we want to make sure that your temperature is not going above 100.4. 100.4. Okay, if it does go above 100.4, you want to reach out to the midwife, and we want to kind of figure out what's going on. If it's viral or something like that, they're going to have you take ibuprofen or Tylenol and see if that takes care of your fever. And if it does, great. If it doesn't, we need to dig into that a little bit more and figure out what's going on. What we're wanting to rule out is infection more than anything. Okay, so that's just the first, like I said, 24 hours. So set a little alarm on your phone, and just do that. You're going to be taking your baby's temperature too, so you'll do it at the same time. We'll go over what those numbers are later on in this. Okay, those are the only two things that you have to monitor in yourself once you're home. So super easy things. And then the rest of the things we're going to talk about tonight are really just, things to expect and some tips that I have for you guys. Now, before I dig into that, I want to talk about this 15 days of rest, because I'm going to keep referring back to it. And it's broken down into 5-day increments. I'm going to put it in the chat feature for you guys too, so you can write it down if you'd like to. I want to really encourage you to share this with anybody who's supporting you. If your partner is not on here tonight, or your main support person's not on here tonight, tell them about this. It's important. Because like I said, you really can't do it without support, especially if you have other children. So it goes like this. We have 5 days in the bed, 5 days around the bed, and then we have 5 days around. Okay. So that first 5 days are in the bed. That means you're coming home from the birth center, you're going straight to bed, and you're going to stay there as much as possible for that first 5 days. Now, are you getting up to go to the bathroom? Of course you are. Take showers? Yes. Take your postpartum baths? Yes. You are going to do those things, but you want to spend as much time in bed as possible. You will have a pediatric visit. Well, it's recommended around day 4 or 5. You're going to get up and you're going to go to that with your baby. That's fine. And then you're going to come back home and you're going to go to bed. If you have a lactation appointment or something like that, totally fine. You're going to do that, and then you're going to come back and go to bed. So this first 5 days is incredibly significant. All right. So this first 5 days, first of all, your milk is fully coming in, right? So your baby's doing lots and lots of nursing. You're up so much, and you do not want your fatigue to get on top of you. So the more rest that you do, even if you're not sleeping, you're resting your body, and that's going to be helpful for your energy. You're also able to kind of doze off here and there. It's a lot easier to do if you're just in bed hanging out. Now, the other thing is, not only are you establishing your milk supply during this time, your baby, you want to be doing as much skin to skin as possible during this time too, okay? Skin to skin is incredibly important. We all know that it's great for bonding, of course, it's great. That's very high on the list. But it also regulates a lot of super important things in your baby. It regulates their body temperature, their blood sugar, their heart rate, and their breathing rate. So the more skin to skin you do, the more it regulates those things, which is really important and helpful for your baby. The other thing about doing this rest too is it's just time. I mean, like I did bring up bonding. It's time for you to bond. Your partner, if they can spend time with you in bed doing some of this too, it's great just to kind of have that time as a family. If you have other kiddos and you're like, oh, how am I going to do this? You know, I don't want them to feel like I'm shut away in a bedroom. You don't have to be. They can come in with you. They can have time with the baby to, you know, kind of do like age appropriate chores for them where they can help with the baby. That's going to help them feel included and involved. Do a little bed picnic, watch shows together, read books together. There's lots of things that you can do together in bed with your other children if you do have other kiddos. Okay. Now, the next 5 days. So then we have 5 days around the bed. You're still spending a lot of time in bed, but you're getting up and you're moving your body a little bit more. This next 5 days around the bed, I would say, is the time where you might get a little antsy and feel like I can get up and do some things. I have energy, and you might, and that's great. But I want to encourage you to continue to rest and kind of try and fight against that if you can. If you're just dying to get out of bed, you know, and we're entering into like this beautiful time of weather and you like need some fresh air, okay, go for it. Get a little fresh air, but just still spend as much time in bed as you can with your baby, okay? And then the next 5 days around the house, you are spending more time around the house. So you're kind of venturing off. Maybe you are sitting outside for a little while, but you're still resting your body as much as possible. Maybe that's on the couch or another room or something like that. Still lots and lots and lots of rest, but you just aren't necessarily in bed that whole time. Okay. Now, like I said, support is going to be incredibly vital during this time. You know, so for partners, or if you don't have a partner and you just have a main support person, the more that they can support you during this first 2 weeks, the better. So as like the first 5 days specifically, and if you can go 10 breakfast, lunch, and dinner in bed would be amazing. That needs to happen. At least the first 5 days it needs to happen if possible. Okay. So, and then if it can extend, that's even better. So the idea is that, you know, if you're nursing your baby, nursing so much, you know, we're talking like every 1 to 2 hours is kind of the norm. So you just basically feel like you're nursing all the time. But who's taking care of you during this time, right? We kind of forget to take care of ourselves. We get tired, you know, we're tired. We, you know, can forget to drink water. We can forget to eat. And so your person needs to be taking care of you that whole time. And that is their role. So you're kind of taking care of baby. They're going to be involved in that too, but their main role is taking care of you. That is going to be super, super important. So really talk about that and how that can happen, right? Once you are done with this rest period, then you're going to start easing back into activity. So during the first 15 days, as if you can, no chores. That means no cooking, no cleaning, no chasing after children, no taking dogs outside or to go to the bathroom or taking dogs on walks or anything like that. If you can, no chores. So that is another reason why this support is so, so important. But 15 days are up, you're going to slowly ease back into activity. So like one thing a day, see how that feels in your body. See how your bleeding goes. See how your energy level goes. And then you're going to just slowly add on to that every single day until, ta-da, you're back to normal. But it's going to take some time. Be patient with yourself as much as you can. Okay, it is going to take time, and there is no rush. There is no rush to get back to normal. You will get there, but it does take time, and you really want to just take care of yourself and listen to what your body's telling you. I want to just say really quick that I do understand that not everybody can do 15 days of rest. I fully get that. I have 6 kids, and the more kids I had, the less likely it was for me to actually get 15 days of rest. Now with my last, I was like solo parenting. And so I, got like 3 days of rest. And then I was taking kids to daycare and taking kids to school. So everybody's reality is different. And all I can say about that is do the best you can. And if you have to get back to it sooner rather than later, that's what you have to do. And then you want to just, those moments that you have where you actually can rest, you want to take advantage of it as much as you can. Okay. So I'll just give you the example. So for me, I got my 3 days and that was awesome. My mom was here. And then I was back at it. But I was very grateful that my kids actually were in daycare and in school. So while they were there, I was turned off. I was in bed, I was with my baby, and I was doing as much rest as I could. And then they'd get home and I'd have to do my thing, and then we'd start over again the next day. It worked. It was okay. I did all right. And my energy levels were okay. So you can make it happen. Sometimes you just have to get a little creative. So the last thing I want to say about this period of time is limit your stairs. You really want to do no stairs if at all possible, but most people have some stairs in their house. Maybe it's just when you arrive home, there's stairs to get up to your door, or you get in your house and you have to get up to your bedroom. That's okay. You'll do those stairs, but you don't want to be doing the stairs lots of times every day. So wherever you're doing your rest, there should be a bathroom on that level. Okay, so if your main bedroom, your master bedroom, doesn't have a bathroom on that level, I want you to think about, how can I get creative to stay on a level where I have a bathroom? Sometimes people have to stay in a different room for a period of time so they can have easier access to the bathroom. Reason why we do that is the stairs are super hard on your pelvic floor. So after birth, after labor, after pushing out, your pelvic floor is weaker. And that's just normal, right? It needs to mend and recover. And that's one of the things that's recovering and healing during your rest time. But while your pelvic floor is in that more weakened state, doing the stairs is the worst thing that you can do, because it's hard on it. During the moments where you have to do the stairs, if at all possible, don't carry anything. So adding extra weight onto yourself while doing the stairs kind of makes it even worse. So if you need to get upstairs, have someone else carry your baby. Don't carry your baby, don't carry the baby carrier, baskets of laundry, things like that you want to avoid. So just do the stairs alone and do it slowly. So you just want to do like one step at a time and go really, really slowly. You want to avoid the stairs if you can for the first 15 days. And then you can slowly start easing back into it, but take it easy. Protect that pelvic floor as it's mending and healing. Okay. Any questions about any of that so far?
I have a question.
Yeah.
Okay, so this is going to be my 6th child. And I guess my question, since you also have so many kids, so I have 3-year-old triplets and a 1-year-old. And so, how did you pick up your little ones, or like what? I'm not really good, but since you only got 3 days of rest, like how did you pick them up?
Yeah. I mean, I did have to pick them up sometimes. Even when I only had 3 kids or 4 kids, I feel like I always had another little one, for the most part, that I was having to pick up. So just take it, do it as little as you can. But again, it's your reality. And so if you have to do it, you have to do it. I would definitely try not to do it when you're doing stairs because you want to protect your pelvic floor as much as possible. The more independent that they can be, the better. But if you have a 1-year-old, I mean, you got to pick them up, and that's okay. You'll just have to do it. But just be mindful of how you're moving your body and how you're picking them up. Just be careful and protective of the fact that you're also still healing.
Okay, thank you.
Yeah, no problem. Okay, so I want to talk a little bit about pain management. So there's a few things with that. The first thing I want to chat about is afterbirth pains. So after babies come out, you have this period of time of just total bliss and amazing relief. But then it comes time to birth your placenta. And usually people will start to feel a little bit of cramping with that. So you feel like, ultimately your uterus is contracting again, but it feels more like menstrual cramps. Even though it's contracting and there's cramping with that, it's not going to feel like labor contractions because you're not pushing a baby out, right? So very, very different. If this is your first baby, sometimes people don't even notice afterbirth pains because usually they're very, very mild, if not non-existent, okay? But the thing about these afterbirth pains is they get worse with every baby that you have, unfortunately. For you, the person who just said she has 6 kids, I will say that the 6th was definitely the worst. But I have some tips for that. So, but yes, it does get more intense with every baby that you have. Reason for that is your uterus has to work a bit harder every single time, because we get more stretched out. And then after the baby comes out, it has to just work that much harder to contract and control that bleeding. So the afterbirth pains can feel pretty intense sometimes. Now, and those will just continue. So once that placenta's out, they'll really kick in and you'll kind of feel them intermittently. They're not going to be all the time. They come and go like contractions. They're most intense when you're nursing your baby. So when we are nursing our babies, that creates oxytocin to flow through our body. And when that flows through our body, our uterus contracts just like it did in labor. It's the same idea. And so that's why when you're nursing, you're going to feel those afterbirth pains more intensely. Afterbirth pains only last for a few days. And again, they're off and on. It's not all the time. There's just periods of time that they happen. But after a few days, they go away and they're gone. There's a few things that you can do to help. Now, ibuprofen and Tylenol are the easy ones. Like, yep, that's going to help just like it does if you have menstrual cramps. All right. So we have ibuprofen and Tylenol at the birth center. If you want to use, they're going to offer it to you if you're experiencing the afterbirth pains, and you absolutely can use that. And they're going to tell you how much to take and how often once you're home. For those of you who are not wanting to use ibuprofen or Tylenol and you would like a natural solution, I am going to give it to you. It is called After Ease, and I'm going to type it in the thing here. It's a tincture. So After Ease tincture by Wish Garden is the brand. If you just Google that, it's going to come right up right away. You can get it on Amazon. You can just, they have their own website. It is a fantastic solution for the afterbirth pains. You're going to, do you have a question?
Yeah.
That's okay. So you're going to do 1 to 2 dropperfuls in a little water. You don't have to put it in water. You can just put it right in your mouth if you want to. Tinctures are really strong, and if you're not used to taking them, they don't taste good. So it's better to put them in water if you're not used to it. You're going to just take as needed. Most people, you only need to use it maybe 3 or 4 times in a 24-hour period. So it's actually pretty long lasting, totally safe with breastfeeding. If you want to use this, get it now and put it in your birth bag, and you're going to bring it with you to the birth center, and you just take it right away when you start to feel that cramping. It is amazing. I absolutely loved that tincture. It always worked really, really well for me. I didn't use it with all of my babies, but the ones that I did use it, I was like, oh my gosh, why didn't I do this last time? Because it's so great. So I do highly recommend it. If you take it and you're like, yeah, this isn't really doing the trick for me, you totally can move on and use ibuprofen. The midwives are all super familiar with that tincture too. But yeah, so super great. Now, the other thing that you want to think about is around 24 hours after birth, it's really common for your body to just be kind of achy and sore because you just had a baby and you just worked really, really hard. Even if it's like, whether it's a long labor or a short labor, it doesn't really matter. You will probably be sore, like in your pelvis and your hips. If you're holding tension in your body at any point during your labor, you might have sore arms or sore hands or sore jaw if you were holding tension in your face. So if you are experiencing that, again, ibuprofen or Tylenol is going to be just fine to take. You have a natural solution for that too. And that is going to be oral arnica. So if you decide to get oral arnica, you want to get oral arnica and look up 200 cc specifically. You can just do that on Amazon. They have it at natural food stores, co-ops. It's a homeopathic remedy, and it's going to help a lot with aches and pains, also going to help with bruising and swelling. So it's also going to be really helpful for bruising and swelling that you have in your labia area, in your perineum. It's going to help with that. This is another one that you, if you decide to use this, take it with you to the birth center, because that swelling starts to happen right away after baby's been born. And the oral arnica is going to really help with that. You just take it as recommended on the package. Again, the midwives are really familiar with oral arnica and people taking it. So it's a great, great option. Again, doesn't interfere with anything, completely safe with breastfeeding and all of that. So it's another really, really good option. As far as perineal healing, so afterwards, yes, like I said, there's going to be bruising, there's going to be swelling. That's normal. Whether you need stitches or you don't need stitches, no matter what, you are going to have that bruising and swelling, and that's going to last, about 24, 48 hours. Those tissues heal really quickly. If you don't have any tearing and you don't need any stitches, or maybe you have a little tiny tear and you don't need stitches, you'll be amazed how quickly everything heals and you're feeling pretty darn good even after just a couple of days. Obviously, if you have stitches, that's going to take a little bit more time, about 7 to 10 days, but so that's going to be different for everyone. I have a question here, a preferred brand for the arnica. I know that I guess the one that I use the most would be this one, but it doesn't really matter. That's just the one that I'm most familiar with. The other thing the thing that's going to be helpful for that discomfort is going to be ice packs for sure. And baths, 2 to 3 baths per day is recommended. And you want to wait about 24 hours after you've had your baby and then start taking those baths. For your baths, you want that water to be as warm as possible. And you can add things to it if you want. So you can add Epsom salts, you could get postpartum bath soaks. There's like a gazillion of postpartum bath soaks. You can make them on your own, you can buy it. Highly recommend. It's really helpful for healing, and also it just kind of feels good to take a postpartum bath in some nice smelling herbs and things. So I do think it's great if you want to treat yourself to that. If you don't have a comfortable bath at home, you can get a sitz bath, which just sits on the toilet, so you can put all of those goodies inside there and really warm water and just sit on that. Now, For baths, or if you're using a sitz bath, 10 minutes is fine. You can certainly stay in the bath longer than that if you would like to, but you don't have to if you don't want to, but it is going to help with healing. I'm going to go back now to the ice packs. So when you're at the birth center, we're definitely going to give you an ice pack once we've got, y'all cleaned up and situated. It's recommended to have ice packs, whether you buy them through us and get it in the postpartum kit, or if you buy them on your own. If you don't know what the postpartum kit is, you will learn about it at one of your appointments. I think it's at the 36-week visit, maybe 33-week visit, that you are given the option to buy a postpartum kit. That stuff is for you at home. Everything you need will be at the birth center. So that stuff is specifically for once you go home. They can also just give you a list of the things that you need and you can buy it on your own. That's totally fine too. But regardless, you are going to want some ice packs. All right. Now, if you don't get them through us, I know Frida Mom, I'll just write that down too. Frida Mom is a really great postpartum brand. I love the products. The ice packs are great, but there's a lot of other good stuff that I like too, that they make. Now, personally, when it comes to ice packs, I like to make my own. I like that way better. They last longer. I am able to put things on them that aids in healing. They're called padsicles. There's lots of recipes out there, but I am going to give you a really basic one if you want to write it down. So you're going to want to take 12 to 15 large pads. You also can use newborn diapers. I know that sounds kind of weird, but newborn diapers actually do the same thing as a pad does, but they cover a little bit more area, but they're not too big. So pads or diapers are just fine. On every single pad, you want to just pour a little water and soak that pad to create your ice pack. You don't want to put too much water on it, because if you do that, it's going to just create an ice block. And then you're just going to have this big chunk of ice that you can't unroll and use as a pad. So just kind of be mindful of how much water you're putting on there. And then after that, on every single pad, you're going to add 2 tablespoons of witch hazel, just plain witch hazel, 1 tablespoon of aloe vera, and then a few drops of jojoba oil or lavender oil works as well. And then roll them up and put in a freezer bag. And then just put in your freezer, and they'll be good to go. Then once you get home, you'll put one of those on, and it's going to feel so relieving and wonderful. And then when it's not cold and they still will be able to absorb blood. So you can still use it as a pad. But you'll take it off, and then when you're feeling discomfort again, you'll just use another one. You can't use too many of them. But I do think 12 to 15 is enough to kind of get you through. So yeah, it's a great thing. The other thing that padsicles are good for is hemorrhoids. So if you're experiencing hemorrhoids in pregnancy, chances are they're going to get a bit worse after birth, which, of course they are. You're pushing a baby out, so lots of pressure. And if you don't have hemorrhoids, you might actually get them from birth. And so they are uncomfortable usually, but the padsicles really help not only in soothing those, but also healing them as well. You also can use Tux pads for hemorrhoids. And we do have a balm that we sell at the birth center too that works really well. Or you can use all 3. So, but those will get better with time. Any questions about any of that? Okay, all right. I want to talk about fatigue a little bit. So you are going to have fatigue for sure, because you're not getting a lot of sleep. But I want you to think about still trying to get about 7 to 8 hours of sleep in a 24-hour period. So right now you're going to bed at night, hopefully getting at least 7 to 8 hours of sleep at night here, and you might have some bathroom breaks and things like that. But once baby arrives, like I said, babies are awake a lot at night. And so you're kind of having to piece together that 7 to 8 hours in a 24-hour period. So that's how I want you to think of it. Again, good support is really the only way to get there. So sleep when your baby sleeps. I know that sounds so easy, but it's true. It's really true. The more that you can do that, the better. And if your baby's had a really good feeding and they're settled and resting, if your partner or someone else wants to take the baby for a period of time so that you can sleep, great. In that 24-hour period, you might get a couple of larger chunks. Maybe it's 2 hours. If you're super lucky, maybe it's up to 3. Outside of that, you're kind of just piecing together like an hour, 30 minutes, 45 minutes. But if you can do that, it's really going to help just maintain some decent energy. So as far as partners go, I do think that it's really good to talk as a couple and decide, how are we going to do this? How are we going to make this work? So we're both getting some rest. So ideally, if partners can get their rest in the evening time, that's great. Because you want them to be able to help you the next day, right? So what we want to avoid is both of you getting incredibly exhausted and just, in this place of how do we get out of this? How do we get back on top of this lack of sleep? So if partners can sleep at night while you're up with baby, that's great. It doesn't mean that your partner is inaccessible or anything like that. They're still accessible to you. So if you need to reach out and say, hey, I really need your help here, great, do it. And then they'll help you, and then they'll go back to bed. Everybody has a different system. I know sometimes partners will get up and maybe do the diaper changes, or if baby has a blowout, they'll change the outfit and things like that. Sure, that's fine. If you want to do that, that's great. However you want it to look is just fine, as long as you guys are getting some rest. What I did was I kicked my partner out. I was like, this first 2 weeks, I'm just going to hang out in bed. I need this space. I need to be able to do my thing at night. And then I needed my partner to go sleep in maybe another room, so that I felt like I wasn't waking them up. I could just turn on the light if I needed to and just do what I needed to do while I knew that they were getting some sleep in a different space. I found that to be great. They found it to be great too, because they actually got some sleep. If you have other kiddos too, you have to think about that. Your partner is probably the one that is doing the bulk of the caretaking of the other kiddos. So that's another really good reason for them to be getting some rest as well. So just talk about that and how you can make it happen, find a good system, and have that just kind of planned out so that when you get home, you're like, yep, this is what we're doing. And you can just roll right into that and not get super exhausted together. Nutrition, let's chat a little bit about that. So as far as nutrition goes, in pregnancy, it's recommended that you eat about 300 extra calories a day. While you're nursing a baby, it's 500 extra calories a day. So that goes up a little bit. And you want to stay on top of that. All right. So when we are making milk, our bodies are making milk, we burn 500 to 1,000 extra calories a day. That's a lot. We're just laying there making milk and we are burning 500 to 1,000 calories a day just doing that. But The key is to replenish those calories back into our body. You don't want a deficit, okay? This is not a time to be thinking about that. You want to replenish those back into your body so that you can, it's going to be good for your mental health, it's going to be good for your energy, and it's going to be good for your milk supply. So it's really, really important. You can eat whatever you want. You know, obviously whole foods, healthy foods are ideal. But the reason I say you can eat what you want is you don't need to take things out of your diet because you're nursing. Sometimes we think that, right? Like, I don't want my baby to be gassy, so I'm going to take out dairy and cauliflower and broccoli and onions and garlic and spicy foods, all these things. You don't have to do that. You don't. Your baby should be able to handle it. Further on down the road, if baby's gassy and you need to explore taking some foods out of your diet to see if that helps, fine. You can do that with a lactation consultant and kind of see what works best. But initially, you really just want to be normal because you want your baby to get used to that. Yes, you can have coffee. Totally can have coffee. You need coffee if you're a coffee drinker, especially during this time. So yes, you can do that. Hydration, really important. So stay on top of your hydration, just like you do in pregnancy. There's no magical number of how many ounces of water that you need to be taking in. You want to drink to thirst, but you are going to find that you're really thirsty. You're getting rid of all this fluid, not only because you're nursing, but you also like have so much extra fluid in your body in pregnancy, and your body's getting rid of that. So people are really thirsty. So always make sure that you have a nice big water bottle next to you. Make sure it's full all the time. Supplements. So any supplements that you are on now, you're going to continue taking those. All right. So fish oil, vitamin D, prenatal vitamins. Prenatal vitamins you're going to take throughout your entire nursing journey. Okay. And then once you're done nursing at some point, then you'll stop taking those. But until then, you will continue. If there's anything that needs to be adjusted or taken out, the midwife will let you know. The thing that always comes to mind is iron. Most pregnant people are on an iron supplement just because it's really common, and you'll continue to do that. You'll continue to take your iron until the midwife tells you at a postpartum visit that you can stop doing that. So just continue with all of that. Nursing. So if you, I don't talk a lot about breastfeeding in this class. I will touch on it now and a little bit later too, but for yourself, just remember that if you're having any pain that is more than just feeling a little uncomfortable, like when your baby first latches on, feeling a little uncomfortable for a minute or two is fine and normal because your body has to get used to it. If you've done it before, even your body has to get used to it again. And this is a different baby. So it's okay to be a little uncomfortable at first if that goes away. But if you're experiencing pain, severe pain, like wincing when your baby latches on, please, please, please make sure that you reach out for lactation help so that we can get on top of that and avoid, anything that is more severe. So be sure to really pay attention to that and not just keep going if you're feeling that pain. So we're here to help. The last thing I want to talk about for postpartum instructions is the baby blues, or the hormonal shift that happens after baby's born. So milk is going to fully come in around day 3 through 5 for most people. When that happens, we have a very large hormonal shift that happens in our body. It's actually the largest hormonal shift that a woman will experience in a short amount of time. So it's very significant. Now, lots of things are going on during this hormonal shift, but one of the things that people might experience is just a period of time where you're feeling more emotional. You might kind of just be crying a lot or be more tearful. That's why it's called the baby blues. Baby blues is not postpartum depression. Baby blues is just this period of time while you're having this hormonal shift. Now, sometimes people don't experience any of that. They experience the hormones going away, but they're just like, oh, I didn't even notice emotionally. totally normal. It is very different for everyone. I will say that out of all 6 of my babies, I only experienced the baby blues for like 3 days with my first, and I never did again with any of my other kids. So everybody's different. Every baby's different. Every birth is different. Every postpartum's different. So even if you experienced it before, you might not experience it the same way this time. A few days, up to 7 days, totally normal and fine. If you're feeling more teary or crying a lot, more emotional, totally fine. There's things that you can definitely do to support yourself in that. Good food, good support, rest as much as you can. All of those things are going to help. But if that like a week passes by, let's say 7 to 10 days pass by, and you're still feeling that significant change, like you're feeling significantly more emotional or teary, that's when you want to go ahead and reach out and just kind of make sure that that is not shifting into postpartum depression or postpartum anxiety. If that's continuing, the sooner you reach out, the better. So we can, again, just really get on top of that, so it doesn't kind of just downward spiral and get worse. There's so much support out there and so many different things you can do to help during this time. So if you experience that, feel bad, embarrassed, I know that it's hard, but please, 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 again, reach out. The birth center is there for you. The midwives are there for you, and their support is just incredible. So be sure to do that if you're feeling more teary or anxious, or if you're really just experiencing big emotions of any kind consistently. You want to definitely reach out for some help with it. All right, we are going to move on and talk about newborn instructions. Before we do that, does anyone have any questions or comments? All right, we are going to go ahead and move on then.
I have a question.
Oh, yeah.
Will you, stepping back to sitz baths,
Mhm.
can you do like an herbal rinse where you're more kind of up in that, or do you want to avoid that for like infection or?
You don't want to insert anything. So like you wouldn't want to put anything inside the vagina, but the peri bottle, that you rinse with afterwards. Do you know what I'm talking about?
Yeah. Yeah.
Yeah. So
Yeah.
for those of you who don't know what that is, after baby, you don't want to, like, after you go to the bathroom, you're not going to wipe with toilet paper. They're going to give you something called a peri bottle that you'll fill with warm water and rinse yourself that way versus wiping. But you absolutely can put herbal bath in that and rinse with that. You can do it every single time if you want to. I think it's great.
Okay.
Yeah.
Awesome.
Yeah, no problem. All right, so newborn instructions. So at the birth center, once baby's born, there's a few things that we'll be monitoring in your baby once they're on your chest and hanging out, which is always just best ever. But while they're on your chest, they're going to be making sure baby's lungs are clear. They're breathing, they're going to pay attention to their breathing rate, their heart rate, their color, and then also their temperature eventually. That doesn't happen right away. Those other things they're paying attention to right away, and then eventually they'll take their temp after they've done some skin to skin with you. So while all that's going on, again, you're doing skin to skin, or at times your partner might be doing skin to skin as well, which is also great. Some things that you might notice about your baby. So when baby first comes out, they're not pink, right? They're bluish, they're purplish, and that is normal. So if you notice that and you're like, worried about it, don't be worried. They do transition. They pink up is what it's called technically. And that happens the more your baby's breathing and taking those nice big breaths. So for some babies that happens pretty quickly. For other babies, it takes a minute or two for them to pink up and transition. Not all babies cry right away, right? Especially babies that were birthed unmedicated and naturally, especially babies that are born in the water. This is a gentle birth space, right, for your baby. And so they don't necessarily come out wailing. Some do, some come out and they've got something to say. But others just kind of chill out and they're just hanging out. They're still going to be taking some breaths, but they're not doing that big cry maybe initially. If the midwife's wanting them to take a nice big breath, and sometimes a big cry is what needs to happen, that'll happen with just some like gentle stimulation of rubbing your baby, talking to your baby, and they'll, you know, the midwife will be doing that and telling you to do it too. You might notice too that your baby has a cone head. That is because the bones in their skull are not fused together yet like ours are. So they're able to mold and shift during the birth process. And so if they've spent some time hanging out in that pelvis, or if you've had a longer pushing stage, chances are your baby's going to have a decent cone head. And just know that that goes back to just a nice round little shape within about 24 to 48 hours. It's even making huge changes by the time you leave the birth center. So no worries about that. Now, some babies, like we hear about cone heads the most, and that's what we see the most, but depending on where your baby was hanging out in the pelvis and how they were moving down, they might have a different, like it might be kind of off to the side, or sometimes babies, if they were kind of getting hung up on the pubic bone, they might have like a little ledge on their forehead. All of that's fine. It goes away. And it's just one of the cool things about babies' heads that help us with the birth process. You might notice too that your baby has some bruising on their face. That typically happens more often with babies that are born faster. So if they're really fast, that pushing stage is super fast, especially if this is not your first baby, they might have some bruising on the face. So it can be like all over their cheeks, their head, it can kind of just be everywhere. And just know, again, that's normal. Just kind of be mindful to be kind of, you know, gentle on their face, but that bruising heals up really, really quickly. Within the first 24 hours, that's pretty much gone. So now, once you're home, there's a few things that you're going to be looking after in your baby, just like you do in yourself. But one of the things is different, and that is you're going to be kind of just keeping an eye on your baby's breathing. All right, so that's one of the things we're going to be watching for at the birth center, and your baby's not going to be discharged from the birth center until that is looking good and stable. So it's pretty rare to get home and have that change, right? So it's really rare, but it can happen. And so that's why we want you to keep an eye on it. You're going to be keeping an eye on your baby's breathing for the first 48 hours specifically. Now, you don't have to do it ever so often. You don't have to, you know, chart anything or anything like that. You're just keeping an eye on it. And remember what I said at the beginning of class, that the more skin to skin you do, regulates that breathing. Okay, so we're keeping an eye on the breathing, but we're also actually regulating it with our own bodies. It's pretty amazing. Now, you're going to notice in your baby's breathing that it's kind of all over the place. It's sometimes fast and sometimes slow. They're going to make lots of noises. There's lots of variation, and that's fine. That's normal. They're getting used to breathing on the outside. They're getting used to breathing oxygen. The placenta was doing that for them for so long. They did a lot of practice breathing on the inside, but they were breathing
amniotic.
So they were breathing amniotic fluid. So it's going to be quite different for them to breathe air, and they have to get used to it. So the variation is fine. But if you're hanging out with baby and you notice that their breathing seems to be fast and it's staying fast, or it seems slow and it's staying slow, just count their breaths. So you want to take their respiratory rate, and how you're going to do that is you're going to count their breaths for 1 minute. And then you're going to do it for another minute just to make sure, because it's hard. It's really hard. So, I mean, it's not too hard, but you got to really, really pay attention. So that's why it's good to do that for another minute. You want their respiratory rate to be 40 to 60 breaths per minute. That's what we're going for. That's a lot faster than what we breathe. We're about 20 to 30. So it is going to be faster than us. If you pay attention to that respiratory rate and it's below 40 or above 60, you're just going to give the midwife line a call. They're going to talk to you. They're going to ask questions, FaceTime you, listen, and they're going to help determine if everything's fine or if baby needs to be seen. So they will help you with that. Some other things to take note of if you are noticing the fast or the slow. There's a few other signs that there could be a little bit of a problem. One is nasal flaring. So that doesn't mean nasal flaring every once in a while. It's like all the time, like nasal flaring with all of those breaths, and you're noticing that. The other one is grunting. So your baby is going to grunt here and there. That's fine, no big deal. But what we're looking for is grunting with every breath. If they're making a little sound with every breath, that's a sign that they could be having a little bit of trouble. And that's another reason to call. The final thing to look for is retraction. Retraction is when they're having to really work hard to breathe, you'll notice it in their torso. You'll see their little ribs protrude with every breath. You'll see their tummy muscles really working with every breath. And you can just see all of that working. And if that's happening, that's another reason to call and just check in and make sure that it's not a sign of distress. Okay. Now, and that's again, just the first 48 hours, and just, keep a little eye on it, and the skin to skin is going to be really, really good. The other thing that you're going to make sure of is that your baby's staying pink. So like I said, baby's going to pink up at the birth center, and then they should just remain that lovely pink color. The only place where it's okay for baby to have bluish or purplish color on their body is their hands or their feet, or their hands and their feet. At different times, it kind of comes and goes. That's fine. You're going to notice that mostly right after birth, like that first few hours. Their circulatory system has to mature, and it has to, kind of work its way out. So the hands and feet off and on are just fine. But your baby should not ever have any blue or purple color anywhere else on their body. If a baby is having more significant respiratory distress, where that purple tends to show up our blue is on their face, around their mouth, their lips, around their mouth, okay? If that were to be happening, that is not a call to the birth center, that is a call to 911. That is more of an urgent reason to reach out and more of an emergency, okay? All right, so the next thing that you're going to pay attention to in your baby is their temperature. Now, again, best way to regulate your baby's body temperature is skin to skin, hands down. They can't do it very well yet. You want to take your baby's temperature every 4 to 6 hours for the first 24 hours, so the same as you. Now, when you're taking your baby's temperature, the best way to do it is just a digital thermometer under the armpit. Best way. You don't want to do rectal because it's really easy to cause injury in a brand new baby doing it rectally, okay? Ear thermometers are too big for newborns. You can technically use a forehead thermometer, but it's not great for a newborn. We find that there's some error often. So really it's under the arm, digital thermometer. You want that temp to be between 97 and 99 degrees. If you take the temperature and it's below 97, you want to take your baby's clothes off and do skin to skin with a blanket over the top of the two of you. Either you or your partner can do this, that's fine. If the baby's temp, you take it and it's above, oh, sorry, I got ahead of myself. Take it 30 minutes later. So do the skin to skin with a blanket over the top of you. 30 minutes later, take the temp again, and it should be where it's supposed to be. If it's not, reach out at that point. If you take it and it's above 99, take the baby's clothes off and do skin to skin without a blanket over the top of the two of you. Again, take the temp again in 30 minutes and see where it's at. And if it's not where it should be, give us a call. Now, the general rule of thumb with when you're not doing skin to skin, what should your baby be wearing? Just one extra layer than what you are wearing. Okay, they do not need tons and tons of clothing or tons and tons of blankets. Now, if you keep your house super cold, like as we're getting into summer months, if you have air conditioning and you keep it really cold, if you have 2 layers on, they're going to need 3. But if you only have 1 layer on, they only need 1 extra layer. So that's really kind of the best way to go about it. All right. It's super easy to overheat your baby. Super easy, because if they're dressed and they've got like maybe a onesie and an outfit and a blanket, and you're holding them and you're laying in bed, you're nursing them, it's so easy for them to get super toasty. So just be mindful of that, and you'll notice it in them. Their little cheeks will get red. You'll feel it in them and be like, oh, they're getting pretty warm. And so you'll just take a layer off. But yeah, that's kind of the general thing with the temperature. And again, it's just the first 24 hours that you're keeping an eye on them. So that's it. Those are the main 2 things that you are keeping an eye on for your baby during this time. So it's really pretty easy stuff. The rest of the things that we're going to talk about tonight for your baby are, again, just some tips and things to expect. Now, as far as skincare goes with your baby, we are not going to give your baby a bath at the birth center. That's something you'll do at home, and you want to wait until that cord has fallen off to do a full bath. You want to keep that cord side as dry as possible. So if you're feeling like you need to bathe your baby before that, it'll be a sponge bath. But I want to say that there is no rush to bathe your baby, and there's benefit to waiting. Okay, so your baby's not dirty. Okay, so if there's a little like blood or whatever from the birth, wipe that off. That's fine. But as far as their whole body goes, they're really not dirty. If they kind of if they have like a blowout or something like that, obviously you're going to wipe them down. But again, as far as like a full bath, there's no rush to do that. So the main reason for that is that body temperature. So it's hard for them to maintain their body temperature. It's hard for them once they're cold after being wet from a sponge bath or a regular bath. It's hard for them to get back to that comfortable place with their body temperature, and they can get real cranky about it. So it's up to you. But if you want to give them a bath, like a sponge bath after 3 or 4 days, that's fine. Full bath after that cord's fallen off, but they don't need a bath like super frequently. It also will dry out their skin. We don't recommend any body products for baby for at least the first 4 to 6 weeks. Reason being is that their skin is super sensitive. Even if you're using natural products, their skin can be sensitive to that too. So just warm water and a soft cloth is good enough. As far as like moisturizer goes, we do not recommend sugar or anything for your baby that first 6 weeks. If you're feeling like you have to put something on their skin because it's dry, food grade coconut oil is really the way to go. Food grade coconut oil is like magical for many things, and that is one of them. So just use that. Now, as far as the cord goes, typically the cord falls off in about 7 to 10 days after birth. It just dries up and falls off. You don't need to do anything to it except for keeping it dry and kind of protect it, make sure it doesn't get pulled on or anything like that. Generally, that cord kind of falls off in stages. So it'll like kind of come off, and then, it'll just hang out there for a few days, and then it'll continue to kind of detach itself, and then eventually it falls off. You're changing an outfit or a diaper and you realize like, oh my gosh, the cord's gone. Where did it go? But just kind of be a little protective of it until that does happen. Even if it's hanging on by like the smallest piece of any, like tissue or whatever, do not pull it ever, ever, ever. Just let it fall off on its own and it will eventually. Really the main thing that you want to look for as far as like if it's becoming too irritated is redness around the cord site. Now it says in your paperwork, smelly discharge is another one. Yes, it is, but really chances are it's going to get pretty stinky in those final days. And that's okay as long as there's not redness around the cord site. So if it's gunky and kind of like has like a discharge and it's red, that would be a reason to reach out. The redness is more of an indicator of irritation or infection than anything else. All right, we are going to talk just a little bit about baby poop. Now, for those of you who have had a baby, you know all about this, but if it's your first baby, there's a few things to know. Your baby's first poop is called meconium. It's very dark in color, like blackish, very dark brown, very dark green, it kind of varies. It doesn't smell, which is a bonus, but it is super sticky and messy. Generally, it happens around 10 to 15 minutes after birth for most babies. It just like things kind of get stirred up from the birth process. They come out and then, you know, you're doing skin to skin and you look down and all of a sudden there's meconium everywhere. Sometimes it happens before the birth process. You know, it happens inside the bag of water. Sometimes it happens as birth is happening. That's another variation of normal, but usually it's a little bit after the birth process for most babies. But not all babies. Some babies wait to do that. Even, you know, they don't even do it at the birth center. So if your baby has not had their first poop at the birth center, they want you to just kind of keep an eye on it and make sure that they have their first one within the first 24 hours. If they haven't pooped after 24 hours, you'll reach out to the midwife and just kind of check in and see, just let her know basically. Usually it happens very shortly after that. Now, after that first meconium poop, which like I said is really dark, and your baby that first couple of days will have a good number of those. As the more they nurse and as your milk starts to fully come in and transition, their poop transitions too. So around day 3 or 4, that poop changes to more of a light green color and it's more runny in consistency. It's not sticky anymore. And then around day 4 or 5, it's changing to a mustard yellow color. And it's going to stay that way until you introduce something else. So it's mustard yellow, runnier in consistency. Sometimes it has what looks like white little seeds in it, very normal. All that is fat from your milk, so totally fine. But it stays that way until you introduce solids. So if you introduce solids around 6 months or so, obviously their poop is going to change at that point. Or if you introduce formula at some point, that will also completely change what their bowel movements look like. When you leave the birth center, they're going to give you a chart that kind of keeps track of how many wet diapers, how many poopy diapers, and how many feedings. That chart can be helpful, number one, because it's hard to keep track just in your mind, and you can look back to it and be like, oh, you know, I hope my baby's getting enough. Oh yeah, they had 3 wet diapers yesterday. That's great. That's right where they should be. That's going to be really helpful to look back on. Also, you need to be feeding your baby 8 to 12 times in a 24-hour period at least. Sometimes, you know, sometimes babies definitely want to eat more than that. But you want to make sure that they're at least eating 8 times in a 24-hour period. I will tell you that is the bare minimum of what a baby should be eating in those first couple of weeks. Now, eventually, yes, you'll get there. But in that first couple of weeks, your baby should really be eating a lot more than just 8 times in a 24-hour period. They should be eating at least every 2 hours. That's what most babies are going to do. Now, if you have a sleepier baby, so let's say your baby's super sleepy and wanting to take longer naps, you don't want your baby to do more than 2 3 to 4 hour naps in a 24-hour period. Okay. If your baby is sleepier and wanting to take those longer naps, you'll want to wake them up around that 3 to 4 hour mark and make sure that they wake up real good so that they can get a good feeding in. And if they are taking those 2 big naps in 24 hours, they should be eating very frequently in between those times, at least every 2 hours to make up for lost time, basically. Okay. For the most part, we really want you to just follow on-demand feeding. So anytime your baby is showing signs of eating, you want to feed them, even if they just ate. Even if they had a really good feeding for like a whole hour, they're done, and 15 minutes later, they're looking for food again, feed them. Okay, you want to stay on top of that on demand. That's going to help your milk supply. It's going to help them also get back up to birth weight. Okay, so you're really, really focusing on that, especially that first 2 weeks. Now, once baby's back up to birth weight, 2 weeks have passed, your milk's, flowing, you've got a good latch established, then, you can start to let your baby take those bigger nap breaks if they're wanting that. But that first couple of weeks, you want to pay more attention to it. So the on-demand feeding is great as long as your baby's actually waking up to eat. But if you have a sleepier baby that's having a harder time with those feeding cues in those early days, that's where you really want to pay attention to how often your baby's eating and make sure that you're waking them up to stay on top of that. You will thank yourself, even though the first 2 weeks is super hard with, fatigue and all of that. If you could get that milk established and that good weight gain in that first couple of weeks, you're going to be able to just have a smoother 3rd week, 4th week, 5th week, and beyond. So yeah, you want to just focus on that. Now, I don't really talk any more about breastfeeding than that because this class is not the breastfeeding class. But if you are a first-time parent, the breastfeeding class is required if you are choosing to nurse. So you'd want to take that. And if you just need a refresher, it's a great class. Amber teaches it and she's wonderful. All right, so as far as sleeping patterns go with your baby, there really isn't a sleeping pattern. Just like there's really not an eating pattern. You're just kind of going with the flow. And that's really like, whenever I talk about giving people advice for babies, it's go into this with very, very little expectation around patterns or schedules. Eventually you'll get to a pattern and you'll get to a schedule, but it takes time to get there, and do not expect one in the first, even up to 12 weeks. So really be patient with yourself and be patient with your baby. I find that people struggle more with stress and even postpartum depression and anxiety when they're having all these expectations around schedules and patterns and times. And when am I going to, when can I expect that my baby's going to sleep for 3 hours? When can I expect that my baby's going to sleep through the night? Every baby's different. We don't know those things. So just really give yourself grace and give your baby grace during that time. And I promise that eventually you will get there. But the sleeping pattern really does not happen until later. They do not have a circadian rhythm. They're not born with one. That is something that is actually a development that has to happen. And we cannot force development. We have to wait for that to happen in your baby. So really just be patient during that time. And that's why it's good to piece your sleep together too. Like I said earlier, the more you can piece your own sleep together, the less you're going to care about what hours and times your baby is sleeping. It's not going to matter as long as you're getting a little bit of rest yourself. Now, the home visit. So let's talk about that for a minute. Your home visit's going to happen around 24 to 48 hours. The nurse is going to come to your house. She's going to do a few of the newborn screenings. She's also going to check for jaundice. Now, we don't do the blood test for jaundice. she's just going to check for signs of jaundice. If your baby's showing signs of jaundice, she's going to say, go see a pediatrician sooner than that day 4 or 5, so you can get those bilirubin levels checked out and see if baby needs a little extra help in that area. The last thing that I want to chat about is just a few tips that I have for people that have a fussy baby. Now, babies generally are really calm the first 2 weeks. Okay, so the first 2 weeks, babies are pretty chill. You know, they're sleeping and they're eating, and that's about it. But 2 weeks passes, and sometimes babies can start to get fussy. Usually this fussy period of time happens in the evening around dinner time, and it can extend into our sleeping hours. Sometimes babies will cry for an hour, sometimes it's 2, sometimes it's 3. It's hard. If you have a baby that is having these fussy periods of time, usually it's every night around the same time. It's hard when we're tired, so it takes a team effort to get through this. I have a few tips to help with soothing, and you'd want to really take turns with your partner or someone else to get through this period of crying each night if you experience it. Not every baby does it. They don't. So don't just, I'm not telling you this like as an expectation, because it's not an expectation. I'm just telling you it because sometimes it happens. And if it does, it's really frustrating. One of the things that you can do is, it's called the 3 S's. So you swaddle your baby, you sway your baby, or just some sort of movement. You can sway, you can bounce, you can walk, you can sit on a ball, whatever it is, but you're doing movement. And shushing. So literally like shh, 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 in like a rhythmic sound. Another reason why people use sound machines. The sound machine kind of does the same thing. Those 3 things together, so swaddle, sway, shush, is soothing to your baby. So if you want to try that, and if it works, great. If you have to keep doing it and you get tired, hand your baby off, someone else can do it, and you can kind of go back and forth. It's not always going to work. Some other things that might be helpful: a car ride. If your baby doesn't like the car seat or car rides, that's not going to be your option. But if they do and you need a little break, go on a car ride. Nothing wrong with that. The other one is just step outside with your baby. Get some fresh air, get out of your space. Sometimes babies, you know, we all need that sometimes. Sometimes you just need to get out of your space, step outside, and that fresh air can just like rejuvenate everyone and cause your baby to actually calm down and just like acknowledge, I'm in a different space. I'm outside. I'm seeing different things, and that can be helpful. The last one is water. Give your baby a bath. Water is a magical solution for children of many ages. So, and your newborn is no different. So just giving them a bath can be enough for them to be like, you know, this feels really good. And it can stop that crying and just help to soothe them. Sometimes you have to try all of those options before you find one. And one night, one thing might work, and the next night it might not, but just keep trying. Please know that if you do have a fussier baby, it will get better. Support from friends and family can be super helpful, but it definitely will get better. Baby wearing can be helpful too. So if you want to try baby wearing, that can be super soothing to your baby too. If you are planning on baby wearing, you want to try that out within the first 2 to 4 weeks so that your baby can get used to it. Because if you don't baby wear, and then, you know, your baby's 6 weeks, 7 weeks old, and you're like, oh, let's try out this carrier, they might not like it at that point. But if you start doing it right away, it's great. Partners can do baby wearing before, like while you're doing your 15 days of rest. If they want to check out the baby carrier and do some baby wearing around the house, that's great. Great option. You can't do it too soon. So you absolutely can try that right away if you'd like to. All right, that is it. That's all of the things that I wanted to go over in tonight's class. Before we sign off, does anybody have any questions? All right. Well, that's easy. You're an easy group. Thank you guys very, very much. If you are taking the childbirth ed class, I will see you there. I teach that one too next week. So that's exciting. Good to see you all. Have a good rest of your evening. Take care. And if I don't see you, have a great birth. You're going to rock it. And I will see you around the birth center, hopefully. All right. Bye, everybody.